Good morning. I'm Cynthia Tish here with Dr. Tish on the new talk show, Coffee Talk with Dr. Tish. You can listen in every Saturday morning at 7 a.m. Or you can get us on Facebook. We're on Facebook Live, and then we'll share the video to the Recharge Clinic page. Today, we're talking about spring cleaning your health. We're going to be discussing vitamins that are great for detoxing, energizing. We're going to talk about weight loss, sclerotherapy, which is treatment for spider veins. We're going to talk about facial aesthetics like botox and fillers and all that fun stuff. We're also going to tell you a little bit about our new expansion of Recharge Clinic on the northwest side of Ocala.
So tell us about that a little bit. That's kind of exciting news for us, and it couldn't happen at a better time.
Yeah. So due to popular demand, Recharge Clinic of Ocala is branching out to the Golden Hills Plaza on 27. That has Horse and Hounds, Dish, Daryl's Diner is going there, State Farm is there.
Lauren Gibson State Farm.
Yep, Lauren Gibson State Farm is over there. Dr. Tish's daughter, our daughter. That plaza is the place to be, actually. It's adorable. It's so cute. If you haven't seen it lately on 27, where everyone knows it for the Horse and Hound Plaza, but it is so cute. So once Lauren went out there, we realized that's a whole different market, and we needed to be out there. So we
have a lot of patients that come from that area. I mean, and it's really quite an underserved area for medicine in general, as well as rejuvenation.
Yeah.
You know, during hits and a lot of the horse shows, we've had a lot of people come in for IVs and stuff to kind of give them a little pep during their shows to rejuvenate them.
And we know those horse people do not want to drive out to Ocala.
It's quite a drive.
They do want to stay over there. So it's a whole new market really over there for us. And we spent some time out there at that plaza lately, and we just know we need to be over there. So we hopefully will be seeing people there in about a month, but we'll be offering everything really that Recharge does offer. So vitamin IVs, fat burning shots, vitamin shots, weight loss, hormone replacement. We also at Recharge Clinic do see people for kind of primary care, quick care visits, and we'll be seeing them out there in that plaza for that too. So that's really cool because we'll be able to offer everything out there in that new cute little plaza.
Which is kind of a new addition, sorry to interrupt, kind of a new addition for Recharge, that we are offering that at our main clinic, quick care. For, you know, we started out offering that for our current patients, for people who may have sinus infections, sore throats, UTIs, things like that. But we've expanded it to the general public as well. And, you know, we know there's a tremendous need for that because most primaries are backed up quite a bit, and it's hard for patients to get in and see them. So for those, you know, minor things, we certainly are available. And that's really going to be a big need out there as well, you know, for those people that are out there, instead of having to drive all the way into town, getting excellent service out there, and
yes,
helping take care of them.
Is excellent service.
So that's what we want to do.
They really don't have, I don't know if they have a medical office out there actually.
There's more closer to 75, but really nothing out there at all.
Yeah,
and so the next closest thing is all the way out in Williston, which is pretty far away.
Yeah,
but
I think it's going to have a really, really good response out there. Well, what we do is a lot of functional medicine, but I think just even that primary care, quick care, just quick visits, you know, I think they're lacking that over there. So that's exciting. So what else? What did you want to start talking about today?
Well, it's like you had brought up in the beginning, spring cleaning to your health. And so basically this is the time, you know, we've gotten into the new year and it's already blown away into March already. So we need to get on it to try.
Doesn't feel like March today.
Yeah, not today. But to try and get on that and really try and get moving towards optimizing our health. We probably all made, or many of us made, New Year's resolutions to get healthier this year, lose weight, and all of those things. And so now it's time to kind of get on it. And what do those things include? Well, you know, one of the primary things that everyone insists on is weight loss and losing weight and trying to, you know, feel healthier. And weight loss is such a big issue. I mean, it is such a problem. It's the #1 epidemic problem in the U.S. is obesity and being overweight. You know, it's unfortunate that they use the term obesity, even though that is the correct medical term for it, because when most people consider themselves overweight, no one really wants to consider themselves obese because it's just sounds bad.
But what is obese? So obese is like 20 pounds overweight, isn't it?
Well, it's based on a body percentage. And so, yes, it is. And really 20 to 30 pounds overweight over your ideal weight, which the ideal weights are kind of difficult to figure out because those were made on those standards have never changed, and they were made on forms that the insurance companies came up with in the 60s and 70s based on people's body habitus, and then they just estimated that above that. So most people, if you were to do, just by weights and heights, are overweight because we just tend to be a little bit denser now. And the same thing with BMI. BMI was, came into be a fad of measurement for being overweight and obese. And it's a simple calculator that most doctors' offices have that they calculate your height and weight and they immediately label you. And I've read many doctors' reports from patients and they say obesity on the patient. And when you see them, they're not obese. I mean, I would qualify for obese on those things.
I'm pretty sure I would.
Yeah. Well, a BMI is basically anything that has a body mass index over 30. And so for anyone that is a little bit, as we would say, dense, and not mentally, they would, well, maybe, but they would also qualify for that. So any bodybuilders, any weightlifters, any athletes, any muscular people, their BMIs are all high. All football players have BMIs of about 35, and of course, most of them are quite lean. So a much more accurate measurement for those people really is percentage body fat, and that's really, really what we're going for. But anyway, I got off of what I was talking about, which I usually do, and I really wanted to get back to obesity, being overweight, and really how do we get back into that. This is such a common problem. It is, as I said, the #1 medical issue facing the United States. And it's not so much the overweight that is the problem, it's the secondary medical problems that go along with it. Many people, it's based on diet because most people who are largely overweight are eating faster foods in themselves are not inherently bad. But the problem is that many of them are fried foods. They have lots of salt in them, and the oils that they're fried with them are not quite as healthy as stuff we may use at home. So these things have much more saturated fats and they cause more, problems with your arteries and stuff. When people are overweight and certain types of being overweight causes your abdomen to get larger, and that can cause what's called metabolic syndrome. And those people are have a higher chance of developing diabetes as well as peripheral vascular disease. So that's why these things it's so important. It's not the fact that, will carrying around an extra 5 or 10 pounds be anything, of concern, because in and of itself, that weight is not really the problem. It is much more everything that goes along with what's contributed to that weight, mostly diet and lifestyle, because people typically who are overweight don't exercise as much, so that's a problem. And then and it really based on what you're eating. So it's that kind of a thing. Most people are forced into that type of eating habits and lack of activity because of stress. Well, there you go. That's another compounding factor in our health. Stress we know is definitely linked with heart disease. We know that it's linked with all sorts of adrenal suppression, thyroid suppression, testosterone suppression, and generally feeling bad. So it's kind of a good indicator of really everything else in our life is just, seeing if our pants are getting tight, then maybe we need to evaluate everything else in there that's going along in our body and kind of taking some steps now to try and improve it. And I'm not going to get into specific diets because there's a lot of opinions about that. And we certainly have, an excellent weight loss program. So I'm not trying to talk about that. I just want to talk about one of the things of spring cleaning is to evaluate your weight and evaluate your health status and to move forward, trying to make baby steps to improve that, to getting on the way of being healthier. And really, in a matter of time, if you make small steps, in a month, all of a sudden you're locked in and now you're feeling better and doing better.
Yeah, I think people immediately, just losing a few pounds, start to feel like a new person. Just a few pounds makes such a big difference in your knees hurting, your back hurting, your energy. I mean, you get a lot of benefit just of losing a little bit of weight.
Well, one of the things that happens to almost everybody is we all have this omentum fat. And for those people that can see, you have this fat that accumulates right up under your diaphragm, and it's kind of right in your stomach area. And it's certainly underneath your skin, and it's in your abdomen, and it's a quick source of energy for our body, and it's kind of a quick storage area where we kind of store fat. And that's one of the things that drops down very quickly when people start dieting. That omental fat goes down. And most people notice immediately that, oh, my bloating has gone away. It's not really bloating, it's fat, but that fat has gone away, and they immediately feel better because, one, they can breathe better. Secondly, they can look down and see noticeable results, and everyone else sees noticeable results. Even though it may not be a huge change in the actual number of pounds, it's a huge thing that makes them feel better. As Cynthia said, it does make you feel better. You can breathe better, you can move better, you can bend over and tie your shoes, and that's the start. And that's a great motivator for people, is once we can get some of that momentum fat gone, that they sort of want to be committed more a little bit because they start feeling better. And that's the main thing really with all of these things, is getting people to get past the difficult part of the diet and exercise to getting them to where they feel good. Because most people feel bad at first because, we're changing our habits. Mm-hmm. And change is not fun for anybody, particularly when we're eating comfort foods. Now we're going to go to foods that are uncomfort. And so that's part of it.
Diets are always tough, and I think it's 30 days to make a good habit, and it's not so hard anymore. I mean, I don't know. I don't think people struggle with the first 30 days completely. I think the first week is usually the hardest, and then it starts to get a little bit easier, and then it just becomes your lifestyle of, this is how I'm eating now. But you see all these people now who are trying to change, I don't know, I'm trying not to offend anyone. So you see all these people online now on social media creating these pages that are like trying to make it a good thing to be big, like a big girl or a big guy. Like, hey, it's okay, stop saying that we need to lose weight. But it's not really about what you look like, because you could, you don't have to be a size 0. That's totally not what we're about. I'm not a size 0. It's really more about health and feeling good, and your body is not made to carry 100 extra pounds.
Yeah. And I think, honestly, that, to Kim Kardashian's benefit, not that I'm a big proponent of her, but her, having a larger rear end and bigger thighs and stuff really helped out a lot of women who are just naturally that shaped.
And that's okay.
And who felt bad. And so guess what? You're right.
Great.
That is a body type. We all have different body types, but within that body type, you can be optimal. And so, yes, there, guys and girls, we all have small, medium, and large frames and those sizes. But within that, now we know, everyone knows, it's not that we're saying that kind of a thing is bad and we want you to all be toothpicks. But within that, just because we say that all body types are good doesn't mean that's a allowance to go out and just be 100 pounds overweight.
Exactly.
Not that we're judging anybody, and not that there's anything wrong with that, but
all right, we're going to go to break. When we come back, we're going to talk about vitamins and detoxing. Hey, this is Cynthia from Recharge Clinic. Guys, are you ready to feel like you're in your prime again? Dr. Tish is Ocala's leading medical doctor treating you for hormone replacement, weight loss, vitamin infusions, and more. You can feel confident that you are being treated by an experienced, knowledgeable, caring physician. Come see us, 47 Southwest 17th Street, Ocala, or give us a call, 352-512-9996.
Hi, this is Lauren Gibson from Lauren Gibson State Farm. Did you know that 70% of Florida drivers are underinsured or not insured at all? In Marion County alone, we had over 90 deaths from car accidents in 2017. At Lauren Gibson State Farm, our mission is to protect and provide for our customers. Please go to my website at insuredbylauren.com or call me today at 352-355-3340.
What's your IRS problem? Do you owe back taxes? Is there a lien placed on your property? Have your bank accounts been frozen or seized? Have your wages been garnished? Are you being audited by the IRS? Are they sending you letters that demand actions and have urgent due dates? Well, solving your tax problems is as easy as calling Taxes 321. The IRS is the largest collection agency in the world. You need the best representation to give you peace of mind. You need experienced professionals that can cut through the red tape and stop the collection process. If you have a serious problem with the IRS, call the Taxes 321 network today. We'll get them off your back.
800-594-0062, 800-594-0062, 800-594-0062, 800-594-0062.
Doctors Without Borders is saving a life somewhere right now. In crisis areas around the world, Doctors Without Borders teams deliver medical care to people caught in conflicts, epidemics, and natural disasters. You make our work possible. Learn more at doctorswithoutborders.org.
If you're into weird stuff on the internet, find our webpage, thegoatfm.com.
Welcome back to Coffee Talk with Dr. Tish. I'm Cynthia, and we're discussing spring cleaning your health today. We talked about how important weight loss is for health and the dangers of obesity. Now we're going to talk about what types of vitamins are important for detoxing. I know in the spring a lot of people want to detox and feel refreshed, and why detoxing is even important for those who don't know about it.
Well, detoxing really is, there's several aspects to it in our body. You know, we've talked before, and I'll just kind of summarize again. We are continuously exposed to really, for lack of a better word, toxins and poisons from the environment, whether it be pesticides, byproducts of plastic residues that are in everything, not just water bottles, but really all canned products, by really bromides, every kind of toxin and thing that's in the air and we're being exposed to. Then we have a lack of actually a great diet on top of that. So our body naturally can really eliminate a lot of the toxins that are in there that are being introduced to it, given proper nutrition and hydration and stuff like that. But since we're not, and since we are bombarded with this stuff, really we have to take all the kinds of steps to really make our body as in fit a shape as possible to counteract that. And this is something that really has been a big transition for me to quite understand, as well as I think most doctors. And it's really not well taught in traditional medicine about these things, but the evidence is really quite overwhelming for all of this stuff, that these things exist. And really, they contribute to lots of stuff. You know, it's not just a disease, it's not just cancer that you're going to get from these exposures, but it's much more insidious and really much more life-altering. You know, fatigue, mental fog, just feeling bad, joint pain, difficulty losing weight. All of those things are as a result of that. Having irritable bowel, having upset stomach all the time. Those things are all contributed from that. So it's not just a straightforward thing, oh yes, you're exposed to this thing and now you're going to have this problem. No, you're just going to feel bad for a while and then probably get that. So detoxing involves several things, really. One of the things that everyone is kind of familiar with is sort of colon detoxing and colon cleansing. And that's not really what I'm talking about, but I will briefly touch on that. So what that involves is increasing our fiber intake to really kind of increase the transit time of our bowels, so that actually decreasing the transit time, I'm sorry, so that it's quicker, so that really we eliminate those byproducts and those toxins that are in our colon. And really what that's doing is really limiting the amount of exposure time that stuff is and has in contact with our body, so it's going through. And so that's really one of the kinds of detoxing. And there's a lot of colon detox diets that can do that.
So let me ask you a question. Sorry to interrupt. So you're saying getting things moving a little quicker is better, so that it's not sitting in your colon and having all those toxins, giving all those toxins a chance to really get into everything. So being constipated would be an issue because it's all just sitting in there.
Correct. And so, yes, it's not, so we're not talking about trying to give people the run, so to speak, but really just trying to make people more regular. And that's a common problem for people with our diet, with a low fiber diet, is bowel irregularity. And so what happens is, because of that, you know, these things, these substances sit in our colon for a longer period of time, and they have longer exposure to our colon wall, and then gives us longer exposure to absorb them. And then also not going as regularly just doesn't make you feel as good. That's just one thing for sure. So yes, we want to increase our fiber so that we increase, you know, the movement through. Now, like I said, it's not to do anything bad. It's just to help eliminate stuff, and that helps get this stuff out. It gets it out in several ways. One, it just kind of pushes it through and gets it out. But secondly, one of the things that it does is our gallbladder secretes bile, which is a digestive form of oils and substances to help break down fat and other things. And that bile, the longer it sits in our colon, much of that is reabsorbed back in. That is where a lot of the toxins reside in our body, because they're oil-based, so they end up being concentrated in our bile. So if we can get something to move that bile out quicker, then our body has to produce newer, fresher stuff, and it's kind of getting rid of the old instead of recycling it. It's kind of like a mini oil change for your body. And that's really done with fiber, and it could be any kind of fiber, just dietary fiber, increasing that, adding things like psyllium, flaxseed, citrus pectin. All of those things are what we call binding agents, and they kind of move things through. None of them are drastic, none of them are severe, and none of them, you know, cause any problems. Now that just takes me up to the next part of detoxing. So that's the colon part of detoxing. And that usually requires, like I said, lots of fiber, lots of water intake too, because that's another problem, is most people don't take in a lot of water, and that affects your bowels as well. Even though you would think it does not, it does. But you want to drink a lot of water because you also flush out a lot of impurities through your urine. So if, you know, your body's not going to just get rid of them. It has to have a certain amount of liquid in your body, and once it reaches that threshold and you've consumed more, then basically that's when you go to the bathroom. So if you're constantly a little bit dehydrated, you're going to keep all of this stuff inside. So that's the idea by increasing your liquid intake, is to sort of increase the whole thing and flush it out. So it kind of dilutes it out and flushes it out. And that's one way of doing it. And actually increasing...
How much water are you talking about?
Most people should drink about 64 ounces of water a day, which is a fair amount of water. But, you know, if you can do less than that, if you can't do that amount, any improvement. I can tell you that I talk to many people who drink less than 1 bottle of water a day.
But in Florida, in this heat, that's probably not a good idea.
It's not, but people get used to it. You know, and one of the things with drinking lots of water is you get used to a certain amount of moisture in your mouth. Some people, if they are constantly drinking water, and their mouth gets used to having that amount of moisture, so when they're not continuously sipping, they feel thirsty.
That's me.
And then there are people who...
Just talking about water makes me thirsty.
And then there are people who don't drink all day, and they're quite used to their mouth being dry, and that's okay for them. But we have to convert those, because there's somewhere in between that's good. So that's that part of detoxing with just water. Now, the third part that I wanted to talk about is really much more vitamin-based and supplement-based. And the next thing we want to do is really support your liver and your body with supplements that are going to help to detox against these things. And if you think about it, your liver and your whole body is like a bucket. And as long as that bucket has a little bit of room in it, your body can maintain, you know, dealing with these chemicals, dealing with these toxins, and really effectively get rid of them. It's when the bucket gets full and we keep adding more in that it overflows, and that's when we start having problems. And so really so the goal with these supplements is to try and lower the bucket load.
I love that explanation. It made so much sense to me, and I explained it to the kids the other day, is with the bucket. It really makes sense. No matter what you do, you're going to get those toxins in your bucket, and just not letting it get overflowing and too full. So how do we not let it get overflown?
Well, so there's two ways, you know, that it really gets full and stays full. One is by not emptying it, and so that means that whatever we get is kind of filling it up. And the second is by exposures. And so exposures are really by our diet, by our environment, and by stress. Well, unfortunately, we can only limit our exposures. We cannot make them go to zero. 20 years ago, we could go live in the mountains, drink fresh water, have fresh air, and eat organic foods, and we were pretty good. Now that doesn't exist anymore, unfortunately. The sad reality is pretty much every place we go, there's probably some form of contamination that we were exposed to, so that doesn't exist. So now we have to really boost our body up in ways to help it do the best job it can to navigate against this stuff. So it's limiting the exposures, not going to zero, but limiting them, and then increasing your body's odds of fighting it. Because when your body fights them, these things get depleted. And it's primarily a lot of the antioxidants get depleted. Vitamin D is a main one here that we see all the time in Florida. Vitamin D is a potent antioxidant and free radical scavenger. And you would think vitamin D is primarily made in our skin, and we get it with milk and fortified foods. But yet almost every patient, other than ones that take supplement that I see, are low. And so,
living in Florida with the sun, everyone
it's
thinks,
ironic.
Yeah.
And so it's because it's being consumed by them. Another one that's a very potent antioxidant, which has gotten a lot of publicity lately, but has been really talked about quite a bit in functional medicine, is glutathione.
Yes.
Glutathione is a substance that's made in our body, and it's used for a lot of enzymatic activity, and it's used as a large as an antioxidant for for lots of reasons, but it is primarily used up. It's one that gets depleted very easily, and so it's one that really taking supplements and increase our glutathione helps our body get rid of these toxins and sort of empty our bucket a little bit. And also talk about emptying the bucket is also using the high fiber diet, and that helps empty the bucket as well. Other things that help improve things are like milk thistle and
what's the citrus?
Citrus pectin.
Pectin. What is that for?
Fiber.
Oh, okay.
It's purely fiber. So basically, citrus pectin is if you were to take citrus pulp and dry it out, that's what it is. It's a natural binding agent. It doesn't have any calories in it. It's used in a lot of stuff. It's used in jellies and preserves and stuff because it's a thickening agent. But when you take it, it actually helps absorb your bile and help it pass through. So it doesn't usually cause bloating. It doesn't cause gas, and it doesn't cause any problems.
And you're
like
talking
that.
about taking it orally with a capsule.
Correct.
Is
You
there
can
other
take it
forms?
as liquid. Oh yeah, it's a powdered form. You could mix it in with your juices if you wanted to. You could just mix it in with water and drink it if you wanted. You couldn't let it sit for a long time because it does thicken.
Now, what about back to glutathione? How do you recommend getting glutathione in your diet?
Well, really, unfortunately, it's one of those things that it's prevalent in a lot of green leafy vegetables and things like that. But one of the things is we're not going to get enough of it that way. So you have to start supplementing it. And how you really supplement it? Well, oral is one way of supplementing it, taking that. But a big problem with that and why we offer the vitamin shots and vitamin IVs is, we have ones with glutathione in both of them, is people who have what we call a disrupted gut membrane, people who have irritable bowel, ulcerative colitis, or just chronically sick, don't absorb as much. So that's a problem because now we're trying to get these supplements in to help repair the body, but they can't actually get absorbed fully. And we call that a ceiling effect. Everyone's body has a ceiling effect of how much vitamins they can actually absorb. You can take as much as you want by mouth, or we say orally, but they don't get absorbed. A lot just passes right through. Your body can only absorb an amount. So when we go to what we call parenteral routes, that's a route that's other than your GI system, we can give you much higher concentrations that bypass your gut, bypass the absorption, and go straight into your bloodstream, and then are going to those organs and cells that need it, and actually delivering them fairly high concentrations to be driven into your cells to help with these enzymatic reactions and help things improve.
Okay. Yep. Glutathione is definitely one of my favorite vitamins. I really have been trying to get a lot of that. And
Glutathione is
good
great
for weight loss too, isn't it?
It is good for weight loss. It's great for your skin. It is really just dramatic for people's skin. Yeah, exactly. Well, can't bathe in it, but it's really good for your skin, and it improves that your texture and just gives people.
But talk about one more thing with glutathione, and then we're going to go on to something else. But talk about glutathione and what it does for skin lightening.
Well, this came about really from Asia. Glutathione has been shown to, in higher doses, cause skin lightening. And so really people over there, primarily the Philippines and that area, take high-dose glutathione. They take it orally, but they also take it intravenously, and it does lighten your skin. It does, with several doses, lighten it. Now, it's not a permanent lightening, but it does last for several years until your body kind of regenerates those melanocytes, which is the pigment in your skin. So honestly, there's really a lot of movie stars here that do that as well, that do that to lighten themselves. Now,
at Recharge Clinic, we actually get quite a few people inquiring about it.
Mm-hmm.
I had no idea about it till like a year ago.
It does. But, more importantly, the glutathione effects are, even if you're not trying to lighten your skin, it's just really how well it rejuvenates your skin. And that's primarily the way it does it. And it's really quite effective for that. It's really good for hair. It's really good for just a general sense of well-being.
Now, we have a high-dose vitamin C IV for many different reasons, but we also have the high-dose glutathione IV. Besides skin lightening, what else are they using that high-dose glutathione IV for?
Well, some people are using it for some chronic conditions and really kind of detoxing as well. And so that's primarily it. People who have a lot of skin problems will take it. Some autoimmune inflammatory problems that people have, certain arthritises and fibromyalgia that are kind of autoimmune based, they respond to that. They help it. Now, it's not a complete cure, but again, it's one of those things that's lowering that load, emptying that bucket a little bit so your body can deal with all of this stuff. Because one of the things that fills the bucket that I completely missed is medication. And, people who are overweight, that we talked about how that can becomes a contributing thing. People who have chronic diseases are all on medications. They're anti-inflammatories. They're on statins. They're on blood pressure pills. These things slow your metabolism down as well, slow down the cellular metabolism, not just your your energy metabolism. And so those things are contributing to filling up the bucket as well. Now, they are necessary for many people. That's fine. But what we want to do then is decrease the other stuff so that bucket stays emptier. And so it's an ongoing battle. And so it's just constantly trying to, limit what's going in and improving what's going out.
So let's move on. Enough of vitamins, although I feel like we could talk about vitamins all day because there's so much with that. Let's talk about the next thing in spring cleaning your health or looks. Let's talk about spider veins. So Dr. Tish is an expert in veins, all veins. He's been the director of a vein center for over 10 years. And when it comes to spider veins, he really is an expert. He can he can definitely lead you in the right direction if it's more than just spider veins, but he is excellent at actually getting rid of spider veins, very painless, very fast. Go ahead and let's talk about that a little bit.
So let me just tell everyone kind of what spider veins are. So most people kind of have an idea what they are. They're primarily the veins that are on your legs. There's those little red fine veins that people have that annoy people. They typically don't hurt. They're much more of a cosmetic thing. Unfortunately, women are more prone to them than men, although men get them as well, but primarily women get them. And women expose their legs more, so therefore it becomes a problem. Now, why do women get them more? Well, there is a slight embryological problem that women have that causes spider veins on their inner thigh and their outer thigh. And that's the most common place where they get them, right above their knee, on the inside, on the outside of their knee as well. And they, everyone knows what they look like. They're little red feathery veins. Sometimes they're blue, purple, whatever. They're not large. And when they're larger and they become ropey, those are varicose veins. But the spider veins, you can push on them and they blanch, and then you let them go, they come back. Like I said, they're typically not painful. Things that make them worse, well, the primary thing that people get them from is hereditary. So, you can thank your mother or grandmother for that. People who tend to have lighter skin, very transparent skin, you can see them more. People who have been on their feet a lot, work on their feet a lot, tend to have them more. So people like waitresses, beauticians, things like that.
What about crossing your legs?
Crossing your legs does not cause that. That's a common fallacy. It does not do that. It does not do that at all. And so standing on your feet, having children, these kinds of things make them worse. How do you take care of them? How do you treat them? Well, unfortunately, there's really only one treatment. There are no salves. There's no vitamins for it. Even wearing compression hose, which helps sort of slow them down as far as you getting them. Really, the only treatment for them is what's called sclerotherapy. And sclerotherapy consists of a medication that is put inside those veins that is an irritant to those veins and actually causes them to fade and eventually close, and therefore you don't see them. It generally requires a series of treatments of that medicine to help them fade. It's not particularly painful. I would describe it as more of an annoyance than anything else, because it's a very tiny needle that goes in there, but it goes into all of those little veins. And it's a very quick procedure, maybe 10 minutes to do both of their legs. So typically, the scenarios, if someone has some spider veins, they get treated. There's several medications that are used. One is glycerin, one is Asclera, which is polidocanol, and these are irritants to the vein, and they've been around for a long time. They're the only ones that are approved for sclerotherapy. Everyone knows about saline. You'll hear people say, I had saline injected. And that was something that was used in the past. Hypertonic saline, that means a very strong salt solution was put in there. But it's not commonly used anymore now, because that caused some white spots in people's legs. So they would swap the spider veins for white spots. So that was not a good idea. And it also caused some blistering, so people didn't like that as well. Anyway, the treatments usually have to be repeated unless someone has a great response with one, but generally unfortunately, people have to get multiple treatments, and they usually are spaced out about 6 weeks apart. That's just the common way it's done. You do a treatment, you wrap someone's leg with a little bit of compression, or they wear compression hose for several days, and then they get evaluated in 6 weeks again, and the ones that are still present get treated again. The other ones just don't. And then it ends up becoming kind of a maintenance thing after that. That will last most people for several years, and then they'll start to get one or two again, and then whenever they feel like they're ready, then they'll start kind of getting some maintenance treatment for the spider veins. Now, as you're preparing, as a spring thing, as people are preparing for summer, it's something that you ought to do way ahead of time. It's not something that you can do on a Friday for a Saturday night, gala and have your legs exposed, because unfortunately they're going to look worse before they look better. They do look a little red, and then they come away. So it's something that you need to plan ahead of time. So people that are planning, their big summer vacation, big beach time, and really want to get rid of them, now's the time to take care of them. Not at the beginning of June for the end of June.
Now, some people are doing laser for them. What do you think about that?
Well, there was a couple of other treatments that came out. Laser was one of them. And what that did was it directed a light beam, which is the intensified laser, over those veins. And it does work. Unfortunately, it's not quite as effective as injection therapy. Injection therapy is what's considered the gold standard. That's the one that everything else is adjudged against. Laser works by generating heat. It actually puts heat inside those veins and causes the damage to that vein lining to cause them to stick shut. The main problem with lasers is, one, it's extremely painful, and you have to have much more treatment. So where on the average, if someone were to just take the average of all people being treated for sclerotherapy, most people just require 3 to 5 treatments. If you were to take that same subsegment of people with laser, they would probably require 5 to 10 treatments. So it's less effective. It generally is more money and more painful. So it's out there, but it's not probably the preferred thing.
Yeah, not the way to go.
Yeah, there's another form that's out there that's come and gone, and it was a needle. It was a very tiny needle that you would actually stick in the vein, and it would generate heat and almost cauterize the vein. The problem is it caused a lot of skin burns and a lot of marks on the skin. So yes, it did get rid of the veins almost 100%, but almost everyone had marks all over their legs that were much worse than the veins. So we tried that modality several years ago, and as we have tried laser, both of them have gone by the wayside.
So what's the price range for the injections for spider veins per session?
Well, it's usually, there are places that charge all different amounts. If you go anywhere in the state, you would find, I've heard of a lot of places just charging by minutes of therapy. That's how they'll do it. They'll charge per 15-minute session. Typically, we charge for the whole leg, so basically the whole treatment. So whatever can be done during that session is one price, and it makes it a much fairer thing, because if someone, it coming in and having just a section of your leg done at a time is not really good care.
Yeah, you probably want to get it all taken.
Yeah, it's uncomfortable, so you might as well go through the whole thing at one time and be done with it.
I've personally had it done. It's like you said, uncomfortable. I wouldn't say it's a terrible thing. I would have it again and again. And the price range, I think, is $150 to $300 per session usually. Right?
Yeah, and that's a reasonable price because
and like you said, you have to get a few sessions most likely. It just depends on how severe and how good you react to it, I guess. All right, so we are going to take another break, and then when we come back, we're going to talk about spring cleaning your face with aesthetics, Botox, fillers,
and threads.
Oh, and thread lifting.
That's an exciting new topic that I want to introduce.
Maybe we can get to talk about vampire facials. I don't know. We'll see.
Probably.
All right, we'll be back.
You cannot ignore Facebook. Facebook live streaming.
The GOAT FM.
It's going to happen to all of us. It is the one insurance we can guarantee there will be a claim on. So the question becomes, will your family have enough money to pay for their mortgage, for their food, or their education, or will they have to borrow money and struggle? Lauren Gibson State Farm has a solution for every situation and can help get you protected today. Take care of your loved ones and take the worry off your mind. Please visit our website, insuredbylauren.com, or call us at 352-355-3340.
Hello, Ocala. This is Brooke from Simply Sunless. Did you know that we are nestled inside of Salon Bliss? Salon Bliss is a full-service salon offering an array of trendy hair colors, cuts and styling, professional makeup application, nail services including manicures, pedicures, and acrylics, and even eyelash extensions. Call the girls at Salon Bliss at 352-620-9360. Visit our new home in downtown Ocala at 212 South Magnolia Avenue. Mention this ad for 20% off your services at Salon Bliss with select technicians.
Document Technologies has been helping Ocala business owners save money on their copiers and printers for more than 7 years. Now they've added the full line of award-winning color copiers and printers from CopyStar. CopyStar has a reputation for their overall low cost of ownership and unmatched reliability. Combine that with Document Technologies' fast local service and 5-year guarantee, you have a combination that can't be beat. Plus, they have special programs for nonprofit organizations and government programs. To find out more about how Document Technologies and CopyStar's award-winning color products can help your business, call Bill Schroeder at 352-368-6664 and start saving today. We use Document Technologies, and so should you. Call 352-368-6664.
And in Gainesville at 372-6666.
Document Technologies, the only copier company you'll ever need.
This is Vicki List, Director of Christian Homeschool Academic Teaching. CHAT is proud to announce a new SPACE program. SPACE is the self-paced academic curriculum and elective approach which provides a stable learning environment with subject matter experts available for regular supervision and assistance. Supervised study time is available 1 or up to 5 days per week beginning this summer or fall. Contact CHAT Director Vicki List at 352-598-8393 or visit our website at chatocala.squarespace.com. CHAT's self-paced academic curriculum and elective program begins this summer and fall. chatocala.squarespace.com.
Hi guys, this is Stephanie from Recharge Clinic. If you have low energy, struggle losing weight, no motivation, or low libido, you may be a candidate for testosterone replacement. A simple blood test will get you started. Call me at Recharge Clinic, 352-512-9996. And again, that number is 352-512-9996.
Hi, it's Colin Cowherd. Join me each weekday at noon right here on your Florida Sports Talk station on 100.1 FM, AM 900, and AM 1230. Tune in to The Herd.
Okay, welcome back to Coffee Talk with Dr. Tish. I am Cynthia, and if you're just tuning in, we're discussing spring cleaning your health. Now we talked about weight loss, vitamins, spider veins, and all that fun stuff, but now we're going to talk about freshening up your face so that you can have a more youthful glow this spring and summer. So that's what this little fun thing is right here.
So this is my little prop for facial aesthetics. And when we talk about things for, freshening up your face, really, there's a lot of things that can be done. One, for some of the wrinkles in your face, particularly your forehead, between your eyebrows, which is called the glabella area. And that's where people usually get deep furrows. We call them double 11s in that area from scowling and frowning. And that's a thing that typically bothers people, and that's easily treated. Lines in someone's forehead up in here can be easily treated as well. Now, this is not really a great photo for those things, but so one of the areas that gets treated is right here, which is right between the eyes and right above the forehead. I just said that, and so thank you. And so basically what medications are used for that are called neuromodulators. And those things are of two forms. One is Botox, which everyone is familiar with. They've done a great job of branding their name. The other one is Dysport, which is another what we call neuromodulators. They're both exactly the same chemical, which is botulism toxin. And although that sounds crazy, basically what it is it's a mild form of a muscle relaxant that weakens those muscles. So it weakens the muscles in your forehead, and it weakens the muscles between your eyebrows to help them relax. And really the wrinkles are not from excess skin. The wrinkles are from the muscles being too strong, pulling the skin together and causing those crevices in there. So what we try to do with this is relax the muscles a little bit, and then the skin smooths out, and it kind of gives you a very refreshed look on both in between your eyes there as well as in your forehead. And it's also performed in your crow's feet as well. And that's another area that has a lot of muscles, and we're squinting and making faces a lot, and those muscles get what we call hypertrophied or thicker. And then when we relax them, they ease up so you don't have those lines on the crow's feet area. So that's one thing that works very well. Botox is very easily performed. It unfortunately requires a needle to be placed, but it's placed in those areas that are where those muscles are thickened, and it helps to relax them. It usually starts working in several days, and you get the maximum effect of it in about a week. And it lasts typically anywhere from 3 to 6 months on people. I say that because some people metabolize it very quickly. People who are very athletic, people who have very strong facial muscles, use their face a lot. It kind of doesn't last as long, but most people it lasts much closer to the 6 month part. So you get a good duration for it, and it doesn't wear off instantly. So it's not one of the things that it starts to fade, and you start noticing these things coming back, and that's when you kind of know it's ready to be treated. You're ready to be treated again. So that's kind of that. Did I get everything on those neuromodulators?
Well, how old? I mean, this is for people who are like over 40, or is this for?
Honestly, it's pretty much for all age groups. Now, certainly as you're younger, people typically don't have a lot of that, but I would say people start getting it in their late 20s now. It was something that was primarily, done in people in their late 30s and 40s, but really now it's all age groups. It's pretty much equally done between men and women. And so really with everyone staying in the workforce much longer, the goal is to look not necessarily younger, but more refreshed, not to look so weathered. And so really that's what the goal is, to take some of the rough edges off and smooth things out of it.
And that really is something that you hear once you start getting Botox or any of these, Dysport, any of them, is, wow, you look like you had a good night's sleep. It's some people who have not had any of this or don't know much about it, I think kind of have this like, oh, you're going to look like crazy. But that's really not the case, especially with what we're talking about here is really just a more refreshed look. Mm-hmm. Just a kind of a little bit of a glow and like you had a good night's sleep, because it just relaxes all of those little wrinkles. And this is, we're talking about from here up.
Yeah, so Botox and Dysport are primarily done from the eyes up, although some people do get it in their chin if they have very active chin muscles, and sometimes in their upper lip occur, people who have some creases in their upper lip that are used from really too much muscle movement in their upper lip. Kind of a lot of smokers and stuff have had those lines in there. And that's what it's primarily used for. There's some other uses for Botox and Dysport. Some people who grind their teeth a lot and bite down a lot and clench their teeth have very large masseter muscles, which are the muscles on the side of your cheek, and sometimes it's used to weaken those things up. Another off-label use, or a use for it now, is headaches. It's being used for people with chronic headaches, and it's applied on their scalp, and it helps dramatically with that. But you're right.
For hyperhidrosis.
Hyperhidrosis, which is excessive sweating. So people have excessive sweating in their armpits or on their hands and feet, and Botox is used for that. It's also used to help relax muscles, like with trigger point injections as well. But the primary use really is for kind of youthful a glow, as it's just, you know, to coin a phrase really for people's face and to help them feel younger. And it is a very subtle thing, and that's really what most people like about it, that it is subtle. You know, when we see people getting what we call facial aesthetics, getting fillers and all of these other things, we all have seen the TV shows with the nightmares of the people that have gone to crazy amounts of that. But honestly, most of the people, we know most of the people that are doing it. This is millions and millions of people are having this done. We probably know most of the people, or are people ourselves, that are having it. And it's done very subtly so that it is not something that most people see. And in fact, we strive to not have that dramatic look. We want it to be gradual. We would rather add more, you know, over several weeks and make it much more so that no one really notices than come in, you know, get a whole bunch of stuff done in one day, and then the next day when you go to work, everyone's like, oh, what did you have done yesterday? Because most people don't like that. There are some people who want that kind of attention, and that's fine, but most people want it to be very subtle. Most people don't want anyone, and are very private about it, and don't want anyone to know that they've had anything done. So if it's done gradually, most people just say, wow, you just look younger, you look like you've rested more, you must be using new skincare products. Things such as that.
Let's move on, because you're not going to have time to talk about everything. So the next thing that we can discuss is fillers. You've heard Juvederm, you've heard Restylane. These are different types of fillers for the face, totally different. And this subject is so huge, we're going to have to be vague, because there's no way that we can really
we'll just have to finish it again.
Well, we can talk
we'll
more
briefly
about
go
it
over it, and then we'll go into it again. So fillers are basically a hyaluronic acid, which is a substance that is in our body.
Sounds bad, but it's totally
it's a substance that's in our body. It's in the joints, hyaluronic acid. When we get joints worn out, that's what they're injecting into joints. They inject it into animals' joints. It's a very common, it's a non-toxic substance. And basically the premise of that is as we get older, we lose the fat in our face. Regardless of whether we are fat or not, we lose fat in our face. And for those of you who can see this diagram, this is what we look like when we're younger. We have lots of fat in our cheeks, and that's what gives us our nice, plump, rosy cheeks. And as we get older, we start losing some of that plumpness. We start losing it from the side, and right on the lateral side of your eye, on the side of your eye, you start losing some of that fat, and then the skin starts to sag a little bit. And so people's face goes from being an upside-down triangle to start being more square, if you were to look at it. And then with time, they lose even more fat right under their eye, and they lose that nice big cheek that young kids have, that we all say, oh, look at those cute cheeks. Well, that goes away as we get older. Not that we're not cute anymore, we just lose the fat. And so what happens is the fat and those structures support the skin and keep it in place. And what happens when that fat disappears is now there's less structure, so the skin starts to sag. And it sags down around your jowls and around your mouth. So people have a lot more skin there, and they get wrinkles around their mouth. The natural tendency is to think, okay, I need to put some fillers around here to fill that in, around someone's mouth. But that's actually just the opposite is true. If you put fillers in around someone's mouth, it makes them look even squarer. It brings even more attention to that area.
People trying to get rid of these lines tend to put fillers here, but really that's not what you want to do.
That's not what you want to do. They may need it there eventually, but primarily you start by lifting that skin back up again. So we want to put fillers back up into the area where it was lost. So it's right under your eyes and along your cheekbone. And that helps now restore that volume, which is the amount of stuff that's underneath the skin, and then starts bringing the skin back up and now starts by that pulling that up. It's like tucking in a sheet. You know, when you pull all that slack out of it, now they're tight again. And basically, we're pulling that skin back up again, back into its previous position, and it helps actually reduce the lines around people's mouth. It kind of restores the cheekbones again, and it kind of gives you cheeks again, and gets rid of a lot of those wrinkles and heavy looking in your face. And then, so that's one step. There's lots of different types of fillers. There's fillers that are very firm, that are used for more structure to add more stuff. There's fillers that are much softer and more pliable. Those are used for areas more subtle, like scars and your lips.
Okay.
And
we're gonna have to shut that down.
Well.
So
okay.
you know what? We'll make sure we plan some time next week to go in more to talk about all of these fillers. We'll talk about thread lift. If you're interested in this, look up thread lift this week, and we're going to really go into that next week and discuss that. We're going to close down today. We want to... Okay, I guess we're out. Hey, this is Cynthia from Recharge Clinic. Come see Dr. Tish at the clinic to get recharged. Offering testosterone therapy for men and women, vitamin infusions, fat-burning shots, weight loss, and more. 47 Southwest 17th Street, Ocala, Florida. 352-512-9996.